Good morning, everyone. I am going to go ahead and get us started since it is 11:01. Please make sure everyone mutes their microphones. If you have a question when question time comes, use your raise your hand feature so that I can call on you so that everyone's not trying to talk at one time. You can also use the chat and ask your questions in chat, and I will either call on you or read your question for you. And with that, I am going to turn it over to Tracy Pope, Director of Community Relations, Mount Juliet Chamber 2021 Board Member. Tracy?
Thank you so much, Marla and Galen, the current chair, and the entire Mount Juliet Chamber for giving Vanderbilt the opportunity, to just update you all on the significant increases of COVID cases and encourage COVID safety to protect yourself and our community. We're joined today with Jay Hinesley, our president of Vanderbilt Wilson County Hospital. I see Dr. Adam Huggins, our chief medical officer, and then Dr. David Arnoff, he's Director Division of Infectious Disease for Vanderbilt University Medical Center. I'll hand it over to you, Jay.
Thank you, Tracy, and thank you to the Mount Juliet Chamber for allowing us to hold this audience today. I am holding this meeting today to request your help. We have a couple different items on our agenda today, but it really boils down to two things. We need your help, and we need your help in two fashions. We need you to educate your employees and your friends and your family, and we need you to enforce the masking and social distancing guidelines that have been put in place. And before we talk further about that, I want to share with you why we're asking your help today. If I could, I'm going to share my screen real quick just to kind of talk through a couple things that have us concerned so that you may understand why we've called this today. So I've got up here first, I have pulled up the state data, and I want to make a couple comments around it. If you look at the screen now, you can see I'm going to pull up our county's information here, just specific to Wilson County. Well, first, let's do that. Let's go to Wilson County, and let's pull up the new cases in Wilson County and look at it from the beginning. If you look at where we started this back in March and April when we started testing and started looking, you can see we've had a couple different spikes in our community. Had a little bit of a bump here. We had some bump here in July and August. And if you recall, early in this pandemic, the message that we put out and across the United States was we have to flatten the curve. And we had a very strong reaction from our community and from the country. And you saw the reaction in this data because we saw a flattening and a reduction in the curve of the spread of this virus. However, if you follow this trend up until October and November, you can see that since October, we've been on an alarming trend upwards. And recently, within the last week, we have seen our 7-day average go up to over 100 cases per day. Now, why is that significant to you, and why is that significant to the hospitals in our area? When we had this bump here, we had a lot more capacity built into our systems to accommodate additional patients that were being seen at the hospital. That's because we generally see a lower volumes of hospital patients in the summertime. When you get over here to this side, we are now experiencing tremendous capacity concerns across Middle Tennessee because we have sick people during this time of year. That includes heart disease. It includes the flu. It includes cancer. It includes all the other things that we are taking care of at any given time. But we've added essentially a new disease to our community called COVID-19. And it's beginning to put significant pressure on our hospitals. And it's not just Wilson County Hospital. What you see here is a trend that we anticipate will continue to rise. And we don't want to be alarmist. We have plans to create additional capacity, and we have contingency plans to continue taking care of patients as they come to the hospital. But I wouldn't be having this call if I didn't have concerns and didn't need your help. And I like to think I speak on behalf of all hospitals in Middle Tennessee in saying that we would like you to educate your employees and your friends and family that this is real, and that we would like you to begin enforcing the mask mandate in your businesses and following the social distancing guidelines that have been set out by the CDC and our state and local officials. The other area I want to show you, if you look at my screen now, October the 6th, the state had approximately 1,000 patients hospitalized. If you look today in the most recent data, we've now crested and had a new peak of 2,000 hospitalizations across the state. And we currently don't see an end to that trend, at least in the short future. My message to you is that this is real, and that this is not about politics. And I'd like for you to understand that we have to work together as a community to stem this, the spread of this. And so the last thing I'll say is I'd like to direct you to the CDC's website. I've got it pulled up here for how you can protect your employees and your staff and your families, and would like you to refer you to the CDC's websites for guidelines that can help you protect not only yourself, but your community. I'm going to stop for a minute. Dr. Arnoff has joined us today to provide some commentary as well as answer any questions you may have. But I'd like to stop there and ask Dr. Arnoff to make a few comments.
Yeah, thank you very much, Jay. And first of all, just let me say what an honor it is to spend some time with you all. And we are all very concerned about the data that you just saw. I just finished rounding in our ICU COVID patients. We have 24 patients in our ICU right now struggling with COVID-19. The reality of this continues to just increase. And we've known for a while how this virus spreads from person to person through our breath. It is easy to transmit. And to be fair, the reason this is a pandemic and the reason we've been on our heels and had such trouble containing it is that a lot of the transmission from person to person is occurring silently. It's occurring in the complete absence of symptoms. Something like as many as 2 out of every 5 people who get COVID-19 never develop symptoms, and they can be contagious and spread it to other people. For the remaining folks who get COVID-19 and get symptoms, it's become clear to us that they spend about a day or two before their symptoms start, where they feel well, they look normal, but they are shedding a lot of virus, as much virus as they will shed when they get symptoms. And that pre-symptomatic group, plus the asymptomatic people together, are really fueling all of this spread. It is definitely not the situation that we could get in front of this pandemic by merely isolating people with symptoms or quarantining their close contacts. It turns out to be much more nefarious than that. And that's why it's so important to not just say, you look like you're feeling well or you feel well, so you must be fine, you must not be infected. And for us to all really do our part to curtail possible transmission. And that really means things like paying attention to social distancing, limiting gatherings, being aware of our surroundings, and absolutely wearing face masks and face coverings, et cetera. So I just want to reemphasize that there are fundamental ways that we can limit spread. And the more we can do that, the better prepared our businesses are going to be, our employees are going to be, and our customers and patrons and visitors will be.
Thank you for that. I'm going to make another comment quickly here. I'm going to put him on the spot, but I want you to understand that this message is pretty clear across health systems in Middle Tennessee. And I don't know if Drew from TriStar would like to say a few things to corroborate what we're doing across the Middle Tennessee region with St. Thomas, TriStar, as well as Vanderbilt to try to spread this message. Drew, do you want to say a few things?
Hey, Jay. Yeah, thanks. Can you hear me okay?
Yes.
Yeah, I think, and I apologize, I joined a couple minutes late, and I heard a couple of your messages and Dr. Arnoff's as well, and I think totally agree with everything you're sharing. And one thing that I think has been great has just been the collaboration between Vanderbilt, TriStar, Ascension, Meharry, and beyond about how important it is to really take the preventative measures out there in our community. And I think it says a lot that all of our leaders across the market are really trying to stay aligned on this on many fronts. I think the discussion about the spread is very real. I think the patient acuity in our hospitals has really started to increase on many fronts, and whether it's being driven by COVID specifically or other respiratory illness, which we're seeing here at Summit and other places too. And so I think it's all the more reason to really, really hunker down and, practice those 3 W's, wearing a mask, watching your distance, and, and it's just so important, and washing your hands, excuse me. And I think it's something we're taking very seriously here. One activity that I've been engaged with the past couple of days is assessing our break rooms throughout the hospital, ensuring that we're able to find a way to practice those measures and open up additional places for people to sit and eat. So I share that example, with this group as, with the business community. We all have employees who are sitting down and eating and need to take breaks and rest and eat, and making sure that we're taking all the measures in those settings as well. So, just want to echo everything you're saying so far, Jay. It's so important.
Thank you, Drew. I want to make sure everybody knows that as a healthcare community, we are aligned in this message right now because we need your help. And that's why I've called this today. I've held a similar call with church pastors yesterday to ask for their assistance. And we'll be doing this again with the Lebanon Wilson County Chamber on Monday to talk through this. And the reason I say that is because this has reached a point where we need to be having these messages because our health systems are going to be taxed in the next 2 weeks. And we need you to do everything you can to help us prevent that from happening. Dr. Huggins, our Chief Medical Officer, would you like to say a few things?
Yeah, and thank you, Dr. Aronoff, for joining us to this. I think this is really where a lot of us feared we would be back in, maybe April, May, when this first started. We were all very worried about what it would look like. And I think maybe when it never really materialized to this effect, I think, unfortunately, people maybe let their guards down, or it opened up, the door for some suspicion around just how real or dangerous a threat this is. But I think we are absolutely seeing, all of our hospitals, getting very close to reaching capacity. We're seeing resources being stretched and things like that. And we know that there's still several weeks to go, or if not several months to go before we kind of have a light at the end of the tunnel in the shape of a vaccine. And particularly, I think with the holidays coming up, and we know what that means. And I know there's been, countless pleas for people to maybe limit their holiday gatherings or avoid holiday gatherings or modify holiday gatherings. I think we all fear that may not be the case for a lot of people, and that's going to result in more cases. And so, for all of you that are leaders in the community and have corporations or businesses that are leaders in the community, the community looks to all of us. It looks to us for healthcare. It looks to all of you as leaders. And if we can all lead by example and lead with one voice, it's much more effective in driving people to do the right behavior. So I would absolutely echo everything that's been said and just ask for your help, because, our nurses are working themselves, incredibly hard and taking great care of their patients at all healthcare facilities. But it's very, very challenging. And it's unusual for us to reach out like this to really ask for help. But I think that speaks to just kind of how serious the matter is right now. So, Jay, thank you so much for bringing us all together, because I think it's such an important message.
Before we open up for questions, I'm going to just reiterate one more time. The most important thing you can do for us today is enforce the mask mandate. And trust me when I tell you, I understand how controversial that is. I understand that you will have employees, you will have customers, you will have community members who are not happy with that. But it is the single most important thing we can do to prevent the spread of this right now. I'm going to stop there and see if anybody has any questions for Dr. Aronoff or otherwise.
I do not see any raised hands or questions in the chat right now.
Okay, excellent. Well, I'll make one more comment, and we'll give back people a lot of their time today, but I want to make one more comment before we wrap up. And I want to thank Mayor Hutto for his leadership in this county. Reinstating the mask mandate is very important to this, and are grateful for Mayor Hutto's leadership in getting that message out and helping us to curb this the spread of this disease. So again, we're asking for your help. We called this meeting because we need your help. And the most important thing you can do is educate your friends, your family, your staff, and to wear a mask. And that's what we're asking. So last call for questions. It looks like Mayor Hutto wants to say a few things. Go ahead, Mayor.
I'm sorry. Jay, thank you for this and for everybody that's on the call today. If you go back to Jay's chart in the very beginning where he showed the counts early on and you saw that first spike was when we actually put the mask mandate in place, and then it went down. Then, of course, it started rising again. We put it back in place. And, of course, now it's risen again. And I really don't have an answer there. I do know that masks are important. And I think we've talked about from our office and reached out to Jay and Tracy and as many people as we can leadership wise to say, what else can we be doing? We don't want to be asleep at the wheel here. And we've tried to come up with a message that said, if people could take the thought process of saying, if I get the virus, I'm going to make sure I don't give it to anybody else. Because we think people right now, and I guess they call it COVID fatigue maybe or whatever, but are saying, gosh, I really want to go to that ball game. I really need to get to work. I really can't stay home. And of course, we're all back out in the world again. So nobody wants to shut the economy down. Everybody wants to stay in school, but we need a safe environment. And so I appreciate Jay doing this. People listen to Jay. People listen to you guys because when they hear me, it's about a Democrat or Republican, or it's about government overreach. But when you speak, you are leaders. You're people that are respected. So we do need everybody hands on deck, spreading the word, how that message needs to get out there. We're behind you 100%. Jay, thank you for what you're doing for our community hospital, and Tracy for the communication that you're getting out, and Dr. David, thank you for that. But I appreciate every person that's on here today. I just want to kind of give some input.
Thank you, Mayor. A couple questions came through in the chat that I want to address. We have been in close contact with the schools. The schools obviously make their own decisions, and they've been following the data very closely and have been making decisions based on the data that they're tracking. And then also what percentage of admissions are COVID related. Right now, we're seeing here in our facility about 20 to 25% of our admissions are COVID related. And if you think about that, and through my lens, the reason that's important is because we've had to increase our staff and increase our capabilities for essentially a 25% increase in care because all the other patients are still there. We still have other people getting sick. And so in a matter of about 7 months, we've had to prepare for a significant amount of growth. And that is taxing our health system and is taxing our caregivers. And it is very hard to sustain for long periods of time. So that's why we're having this call. That's an excellent question. Another question, is our county receiving patients from outlying counties? Yes, that is happening. Every hospital in Middle Tennessee is now experiencing patients coming from outlying counties because they're having difficulties taking care of them. Dr. Arnoff, could you address the mortality rates in this chat box question?
Yeah, I would be very happy to. So the question says, I've read mortality rates are less than 2%. Is that true? Yeah, that is true. If we look at people who are diagnosed with COVID-19, about 1% or so are dying of COVID-19. And that sounds like a pretty reassuring situation to have 99 out of 100 people with the disease not die of it, for sure. But a couple things to put that into perspective. One thing is that that's a much higher case fatality rate than influenza. It's about 10 times higher. And because we're seeing so much COVID-19, it translates into a lot of people. So even if we look at Tennessee as a state, in the last few days, we crossed 4,000 lives lost due to COVID-19, which some people think is a bit of an underestimate, but still, I mean, those are 4,000 people who aren't going to see tomorrow because of COVID-19. So, it might be easy to get lulled into a sense of security by saying, well, gosh, 99% of people aren't going to die of this disease. But we also need to remember that many people get pretty debilitated and sick. A recent report suggested that it's very common for older adults to get delirious and confused with COVID-19. And then, as Jay said, just getting hospitalized from being sick is really stressing our system and potentially making it difficult to provide care for people without COVID-19 who need to be hospitalized. But thank you for asking that question. I think that's a really good one.
I think it's an excellent question. I would just add that, you know, if you don't know somebody yet who's had a loved one or a friend die from COVID-19, you probably will if this continues. And I know too many. So the idea that the mortality rate is low is an argument I'm not willing to accept. And we're not talking about, you know, patients that are in nursing homes and the uber frail. We're talking about people that you probably wouldn't expect. And that's alarming for me. Yes, sir, Mayor.
Yes, just for anybody out there that we have got boxes printed up. It said, please put others first, wear a mask. And we have 50,000 masks that were given to us yesterday by Moldex, a company down at 109 now. So we're going to get those to first responders and other people that need that. But if you know of a place we can put a box of masks, please let us know that. Our WEMA department and law enforcement officials are making sure that we get those out. So just call our office and say, hey, here's where we need a box. Here's where we need masks. And we'll do our best to take care of you on that.
Great. Thank you for that, Mayor. Any other thoughts or questions?
I don't see anything.
Okay. Well, I want to thank the Mount Juliet Chamber for your support. I want to thank you all for remaining vigilant and ask that you stay vigilant, remain vigilant, and continue to keep your family, your employees, and your community safe. If you have questions, please, you can direct them to us. We can provide our information. You can also direct you to the CDC website. There's a lot of valuable information on the CDC website, and encourage you to follow those guidelines now. Thank you so much.
All right. Thank you, everyone. Have a good day.
Goodbye.
Thank you all.
Happy Thanksgiving to everybody.
Happy Thanksgiving.
Happy Thanksgiving.